Hello everyone, I am Dr. D.V. Vineeth, Consultant Surgical Oncologist at Prathima Cancer Institute, Warangal. In this video, I will be talking about cervical cancer awareness. Cervical Cancer Awareness Month is January month. Our target is to spread the awareness of cervical cancer as much as possible. The message for cervical cancer awareness is to inform, vaccinate and to screen. Cervical cancer is a cancer that occurs in the lower part of the uterus. There are around 1 lakh cases of cervical cancer diagnosed per year in our country. It is the second most common cause of cancer in women in India. The problem is serious and there are many patients who are presenting in advanced stages. The average age at diagnosis is around 50 years. The most common cause of cervical cancer is human papilloma virus. There are many strains of HPV, but HPV 16 and 18 are the most common cause for cervical cancer. Cervical cancer can be prevented by vaccination and screening. It is best to vaccinate young girls from ages 9 to 14 years before they are exposed to HPV through sexual activity. The vaccine can be given up to the age of 26 years. There are two types of vaccines. One is a Gardasil vaccine, other is a Cervarix vaccine. The Gardasil vaccine is quadrivalent vaccine. It includes strains HPV 6, 11, 16, 18. Cervarix vaccine is bivalent vaccine. This HPV vaccination has been included in the national immunization schedule in many countries. The efficacy of HPV vaccine is about 95%. Screening for cervical cancer can be done through pap smear or visual inspection through acetic acid or HPV DNA testing. All women who are sexually active and above the age of 21 years should get regular screening with pap smear. Pap smear is done once in 3 years. In women aged between 21 to 30 years, pap smear is done once in 3 years. In women who are in ages between 30 and 65 years, either pap smear can be done once in 3 years or co-testing can be done with pap smear and HPV DNA testing once in 5 years. Above 65 years, this screening is not recommended. My humble request to all women is to get regular screening with pap smear so that we can diagnose cervical cancer early and we can help you to overcome the disease. Thank you.